Hey, you ever think about your pancreas? No? Well, it's about time you did, because this shy little organ, tucked away behind your stomach, is plotting things that could stir up more drama than a soap opera at a family reunion. You see, the pancreas is like that quiet kid in class who keeps to themselves, but once you get to know them, you realize they're either super cool or they've got some serious issues brewing. Today we're diving into the riveting world of your pancreas, where things can go from just peachy to call the doctor now faster than you can say exocrine glands. Let's explore the sizzling signs that your pancreas might be sending you SOS signals. Introduction to the pancreas. The pancreas might be one of the coolest parts inside your body that you hardly ever think about. It's tucked away deep in your belly, sitting right behind your stomach. Unlike your heart or lungs, which you feel working all the time, your pancreas is like a silent partner. It does its job quietly. So, what does this stealthy organ actually do? Well, it's got a couple of super important jobs. First up, it makes enzymes. These aren't any enzymes, though. They're special juices that break down the food you eat. Without these, your spaghetti dinner would be a mess sitting in your stomach. These enzymes make sure your body can grab all the nutrients it needs from your food.
Yay!
But wait, there's more. The pancreas also has a big role in controlling your sugar levels. It makes insulin, which is like a key that opens up your cells so they can take in sugar from your blood. When your pancreas is on point, it keeps your energy levels stable. But if things go wrong, it can lead to big problems, like diabetes, where your sugar levels can swing wildly. Now you might wonder why we should care about this organ. Here's the kicker. Even though it's out of sight, keeping your pancreas healthy is vital. Problems with your pancreas can lead to serious issues. These can be tough to fix and can make you feel really sick. That's why it's important to catch any signs that your pancreas isn't happy early on. Knowing about your pancreas and what it does is the first step to keeping it healthy. Just like taking care of a car, understanding what every part does can help you spot a problem before it gets too bad. As we dive deeper into how to spot pancreas troubles, remember, this quiet organ is a powerhouse. It plays a huge role in keeping you feeling good. Now you know what the pancreas does and why it's important. Let's look into the signs that might tell you it's in trouble. This will help you stay on top of your health and tackle any problems before they get big. Remember, when it comes to health, the earlier you catch something, the better. Common symptoms of pancreatic problems. When your pancreas starts having problems, it sends out signals. They say that something is wrong. These signs can vary, but some are more common than others. Knowing these signs can help you find issues early. This is key for staying healthy. One of the first and most noticeable signs of pancreatic trouble is jaundice. Jaundice makes your skin and the whites of your eyes turn yellow. It happens when there's too much bilirubin, a yellow pigment, in your blood. Bilirubin builds up when your pancreas is inflamed or blocked, and it can't do its job right. If you or someone else notices your skin or eyes looking yellow, it's a good idea to see a doctor right away. Another big red flag is pain in your belly, especially if it's in the upper part near your stomach. This pain can be really sharp and might even spread to your back. It can start mild and get worse over time, especially after eating a big meal. This kind of pain can mean that your pancreas is swollen or that there's something else going wrong in that area. Losing weight without trying is another clue that your pancreas might be in trouble. When your pancreas doesn't make enough enzymes, your body can't absorb all the nutrients from your food. This can cause you to lose weight even if you're eating the same amount as usual. If your clothes start to feel looser and you haven't been trying to lose weight, it might be time to see your doctor. These symptoms might seem a bit scary, but being aware of them is a key step in taking care of your health. Noticing these signs doesn't always mean something is seriously wrong, but it's important to take them seriously and talk to a healthcare professional. They can help figure out what's going on and what to do about it. Digestive issues linked to pancreatic health. If your pancreas isn't working right, it often affects your digestion first. The pancreas makes key enzymes. They help break down food. So if it's underperforming, you might notice many digestive issues. One of the key symptoms is steatorrhea, which is a fancy word for fatty stools. These stools can be unusually smelly, float in the toilet, or look greasy. This happens because your body lacks enough pancreatic enzymes. Without them, it can't break down fats. If you notice changes in your bathroom habits, especially if your stools change, think about your pancreas. Nausea and vomiting can also signal pancreatic problems. Sometimes the pancreas is inflamed or blocked. This can cause stomach pain. It can make you nauseous or even lead to vomiting. These symptoms are your body's way of telling you that digestion isn't going smoothly. Your appetite can also take a hit if your pancreas isn't doing well. You might find that you're not as hungry as usual, or you might start feeling full much sooner during a meal. This change can lead to weight loss and can be a sign that your body isn't digesting food properly due to pancreatic issues. It's also possible to experience bloating and abdominal discomfort. These symptoms can come from a buildup of gases in your intestines. They are due to poor digestion. If your abdomen feels swollen or painful after meals, your pancreas may be the culprit. Consider it. Diabetes and the pancreas. Diabetes is a major health issue that directly involves the pancreas. This organ plays a crucial role in managing your body's sugar levels by producing insulin. When the pancreas fails, it can cause diabetes. Diabetes affects how your body uses sugar for energy. Type 1 diabetes occurs when the pancreas produces little or no insulin. Without insulin, sugar builds up in the blood. It does not enter cells to be used for energy. People with type 1 diabetes must take insulin every day to live. This type usually starts in children and young adults, but it can appear at any age. Type 2 diabetes develops when the pancreas doesn't make enough insulin, or when the body resists insulin. This type is common. It often develops in adults over 45, but it's increasingly seen in younger people too. Lifestyle factors cause type 2 diabetes. These factors include being overweight and inactive. Recognizing the signs of diabetes can be a lifesaver. Frequent urination, excessive thirst, and unexplained weight loss are key symptoms. High levels of sugar in the blood can also lead to fatigue, blurred vision, and slow healing of cuts and bruises. Other symptoms might include frequent infections. You might also feel tingling or numbness in your hands and feet. This is due to high blood sugar damaging nerves over time. If you notice any of these symptoms, it's important to see a doctor for a blood test to check your sugar levels. Early diagnosis and treatment can help manage the condition well. They can also prevent more serious health problems later. Managing diabetes involves keeping a healthy diet. You also need regular exercise and blood sugar checks. If needed, you take medication. For those with type 1 diabetes, it includes daily insulin injections. For type 2, it might need lifestyle changes. It might also need medication to manage blood sugar. Managing diabetes has a critical challenge. You need to check it continuously and adjust. For example, dietary choices can significantly affect blood sugar levels. High sugar foods cause spikes, but fiber-rich foods can help regulate them. Regular exercise is also vital. It helps increase insulin sensitivity. This means your cells can better use the sugar in your blood. Moreover, the psychological impact of diabetes can be substantial. Managing a chronic illness daily can lead to feelings of anxiety and depression. Support from family, friends, and healthcare providers can help. So can connecting with a community of others living with diabetes. It can make a big difference in emotional well-being. It's also important to have regular checkups with your healthcare provider. These checkups can help track your pancreas's health. They also track how well your treatment is working. Regular monitoring helps catch possible problems early. These include diabetic retinopathy. It can lead to vision loss if untreated. Unusual signs you might miss. When it comes to pancreatic issues, some signs might not be as obvious as jaundice or abdominal pain. These odd signs are easy to miss, but they can be crucial clues that something is wrong with your pancreas. One such subtle sign is skin changes. People with pancreatic problems might notice their skin becoming itchy. They might also get dark patches, known as acanthosis nigricans. This condition often appears in skin folds and creases. It is often linked to insulin resistance, a risk factor for diabetes. It can also signal pancreatic distress. Changes in stool color can also provide significant clues about pancreatic health. A healthy pancreas produces enzymes that help digest fats, making your stool brown. If the pancreas is struggling, your stool might become pale and greasy. It will also be more floaty than usual due to undigested fat. This change is a direct consequence of the pancreas not doing its job properly. Another sign to watch for is blood sugar fluctuations. They aren't typical of diagnosed diabetes. You might get low blood sugar, hypoglycemia, or high blood sugar, hyperglycemia. This can happen for no clear reason. Your pancreas might be struggling to control your insulin and glucose levels. Gum health might also be affected. Research suggests a link between gum disease and pancreatic cancer. Inflammation is key in both conditions. If you notice red, swollen, or bleeding gums, talk to your doctor. This is especially important if you have other symptoms and may be a sign of pancreatic issues. Also, some people with pancreatic issues develop an enlarged gallbladder. It is noticeable by a bulge under the right side of the rib cage. This happens when a blockage in the bile ducts causes by a pancreas problem. It stops bile from draining. Unexplained fatigue is another symptom. Many people might not connect it to the pancreas at first. But if the pancreas fails to make enough enzymes or insulin, the body can't absorb nutrients. It also can't regulate energy. This leads to persistent tiredness. Sudden severe headaches can be related to pancreatic issues. This is especially true if they come with other symptoms mentioned here. Headaches can have many causes. They should not be dismissed, especially if they differ from your usual pattern. Risk factors and early prevention. Knowing the risk factors for pancreatic issues is key. It helps prevent them or catch them early when they are easier to manage. You can't change some risk factors like genetics, but others are within your control. Knowing about both can help you make healthier choices. First, age is a significant risk factor. Pancreatic problems are more common in people over the age of 45. While you can't turn back the clock, being aware of this can prompt you to pay closer attention to your pancreatic health as you age. Genetics also play a role. If you have a family history of pancreatic diseases, such as pancreatic cancer or diabetes, you are at a higher risk. You have a genetic predisposition. So, it's especially important for you to watch for the signs and symptoms of pancreatic issues. Smoking is a major controllable risk factor. Smokers are about twice as likely as non-smokers to develop pancreatic cancer. Quitting smoking can significantly reduce your risk. If you smoke, consider seeking help to stop, and if you don't smoke, continue to steer clear of tobacco. Obesity and poor diet also impact your pancreatic health. High body weight and consuming a diet rich in processed foods and red meat can increase your risk of pancreatic cancer. But a diet high in fruits and vegetables can help protect your pancreas. Making healthier food choices and maintaining a healthy weight are actionable steps you can take to reduce your risk. Chronic pancreatitis is long-lasting inflammation of the pancreas. It is another risk factor for getting pancreatic cancer. Heavy drinking often causes chronic pancreatitis, so reducing alcohol intake is crucial for preventing it. Also, some workplace chemicals can increase your risk of pancreatic problems. They include those used in dry cleaning and metalworking. If you work with these chemicals, use the right safety gear and procedures. This will reduce exposure. Early prevention also involves regular medical checkups. If you have risk factors for pancreatic issues, discuss them with your doctor. They might recommend regular screenings or extra tests. These are to check your pancreatic function. This is especially if you're at high risk due to family history or other factors. When to see a doctor. Knowing when to seek medical advice is crucial for addressing pancreatic issues effectively. Some symptoms might seem mild or unrelated at first, but they can indicate serious conditions. These conditions need prompt attention. This chapter will guide you on when it's important to consult a healthcare professional and what to expect during your visit. You may have the symptoms we discussed. These include jaundice, ongoing abdominal pain, strange weight loss, or big changes in your bowel habits. You must see a doctor. These symptoms can be signs of both acute and chronic pancreatic conditions. These include pancreatitis and possibly pancreatic cancer. Another critical time to see a healthcare provider is if you notice a mix of symptoms with no clear cause, like nausea with rapid weight loss, or if you get diabetes symptoms suddenly. You have none of the usual risk factors like obesity or a family history of diabetes. These unexpected symptom patterns may require medical evaluation to rule out pancreatic issues. During your visit, the doctor will likely ask many detailed questions. They will be about your symptoms, medical history, and family health history. Be ready to talk about any health changes. This includes small ones. They can give clues about your pancreatic function. The doctor might also perform a physical examination, focusing on your abdomen to check for any swelling or tenderness. Depending on your symptoms and history, they may order several diagnostic tests. These could include blood tests. They check enzyme levels and other markers for pancreas function. They also include imaging tests. These tests, like ultrasound or CT scans, show the pancreas and nearby areas. In some cases, they may also include more specialized procedures like an MRI or endoscopic ultrasound. Those at high risk of pancreatic issues should get regular screenings. This risk comes from family history or other factors. Doctors might recommend them. This proactive approach can find problems early. It works even if you have no symptoms. It's also important to discuss any concerns you have about your risk factors with your doctor. They can give advice tailored to your health needs. This includes diet tips, lifestyle changes, and strategies for managing or reducing risks. If the doctor diagnoses you with a pancreatic condition, they will discuss the best treatments. These may vary widely depending on the specific diagnosis and the severity of your condition. Treatment could range from lifestyle changes and medications. They manage symptoms and improve pancreatic function. More intensive interventions, like surgery, are for structural problems or cancer. Furthermore, follow-up care is a critical aspect of managing pancreatic issues. Your doctor will likely schedule regular visits. They will use them to monitor your condition and adjust your treatment plan as needed. They may also refer you to specialists. These include gastroenterologists or oncologists. They provide more targeted care. Advances in diagnostics and treatments. Advances in diagnosing pancreatic diseases have been significant. Now, advanced imaging technologies like high-resolution CT scans and MRIs are key. They offer clear images, making it easier to spot issues like tumors and inflammation. Early detection is crucial. Endoscopic ultrasound, EUS, is another tool. It has become invaluable. It involves inserting a small ultrasound device into the stomach. This gets closer images of the pancreas. This is crucial for diagnosing pancreatic cancer and chronic pancreatitis. In addition to imaging, better biopsies have revolutionized diagnosing pancreatic conditions. EUS guides fine needle aspiration. It allows for collecting tissue samples from the pancreas. It avoids the need for major surgery. This method reduces the risk of diagnostic procedures. It can give a definitive diagnosis. This is key for effective treatment planning. On the treatment front, there have been significant strides as well. Pancreatic cancer is one of the hardest cancers to treat. New, better chemotherapy drugs have been developed for it. The drugs are made to target cancer cells precisely. They spare healthy cells. This reduces side effects and improves effectiveness. Another exciting development in the treatment of pancreatic cancer is targeted therapy. This approach uses drugs or other substances to find and attack cancer cells. It usually does little damage to normal cells. Targeted therapy works by targeting specific genes or proteins. They are found in high amounts in cancer cells. It also targets cells involved in cancer growth. For those with chronic pancreatitis, therapy with replacement enzymes is key. It is a part of treatment. This therapy involves taking pancreatic enzymes in pill form. They help with digestion, especially of fats and proteins. This treatment reduces the digestive symptoms from enzyme insufficiency. It also improves nutrient absorption and quality of life. Additionally, the role of lifestyle changes in managing pancreatic diseases has gained recognition. Making changes to eating and exercise helps. Avoiding alcohol and smoking also helps. These changes can all help manage disease. They also boost well-being. Research into pancreatic health is ongoing. Many trials are underway to test new treatments. These include immunotherapy and new drug combos. Immunotherapy harnesses the body's immune system to fight cancer. It shows promise for treating many types of cancer, including pancreatic cancer. Also, the use of personalized medicine in treating pancreatic diseases is rising. This approach tailors medical treatment to each patient's traits. These traits can be found through genetic testing. By understanding a patient's genes, doctors can predict better. They can see which treatments will work and which side effects are more likely. This will optimize therapy. These advances help manage pancreatic conditions better. They also show the need for ongoing research and innovation in medicine. These technologies and methods keep improving. They will help people with pancreatic issues. It's now more important than ever to stay informed and engaged with the latest in medical care.